Hi, my name is Paula Savage. I'm a thyroid nurse specialist based at South Tyneside and Sunderland NHS Foundation Trust. Today I'm going to talk to you about the importance of why you need to take your thyroxine medication after having your thyroid removed as part of your cancer treatment. The thyroid has a butterfly appearance, which is situated in the front section of your neck. It has two sections, a left and a right. These sit on either side of your voice box. In treating your cancer, the thyroid was surgically removed. This was either in two halves, left and right, and this has been undertaken in two separate operations, which are called hemithyroidectomies, or removed both halves together in one operation, called a total thyroidectomy. The thyroid's function is to produce hormones, specifically thyroxine, also known as T4. This is released on demand into the body's bloodstream. The purpose of the thyroxine hormone is to regulate the body's metabolism, essentially affecting how every cell in your body is used. Your pituitary gland, which is situated in the base of your skull, also plays a role in the body's thyroid function, as it produces another hormone called thyroid stimulant hormone, also known as TSH. The TSH is produced and released in response to the body's demand for thyroxine. As once the TSH is stimulated and released, thyroxine is then produced and released. This is known as the body's thyroid loop. Following the removal of your thyroid, your body has no ability to produce its own natural thyroxine anymore. This can cause a condition called hypothyroidism. In this situation, your pituitary gland will continually produce TSH to try and stimulate the production of thyroxine. To prevent this, we replace the thyroxine that you can no longer produce with a medication called levothyroxine. You will be required to take a dose of this medication every day for the rest of your life. This medication is a synthetic artificial version of the body's natural thyroxine, so it will take a while for the body to adapt and adjust to this new formulary. And the advice is it can take up to a year. Levothyroxine comes in doses of 25 micrograms, 50 micrograms and 100 micrograms. And you will be required to take a combination of these tablets to achieve your recommended dose. To achieve the best effect from your levothyroxine medication, it is often advised that you take this medication in the morning. This is because it is presumed a person's stomach will be empty in the morning. But we all live differently, and modern lives do not always allow for such recommendations. So we stress the importance when taking levothyroxine is to take at the same time every day, whilst ensuring your stomach is empty, i.e. you have not had anything to eat for at least 2 hours. That no other medications are to be taken at the same time. It is to be taken with water, no drinks with caffeine in, and taken 4 hours apart before or after any calcium medication. Levothyroxine also requires storing away from heat and out of direct sunlight. The medication has two main functions. One is to prevent the symptoms of hypothyroidism. These symptoms are weight gain, fatigue, feeling the cold more easily, hair loss, dry skin, and muscle sensitivity and aching. The second aim of levothyroxine is to suppress your TSH level to prevent the cancer from returning. A definition of cancer is the multiple production of cells beyond the body's natural requirements. TSH stimulates the production of cells. If we suppress your TSH with levothyroxine medication, we reduce the body's ability to produce cells, hence reducing the risk of multiple production of cells, i.e. the cancer. This process is called TSH suppression. The range for your TSH suppression determines your dose of levothyroxine. This suppressed TSH level is personalised to you and is determined by the type and size of the cancer, whether the cancer was found in any of the other surrounding tissues, such as your lymph nodes and/or in other parts of your body, and also the overall effects of the treatment had on this cancer. The process of determining your TSH suppression level is called risk stratification. Your risk stratification is undertaken by the oncology team at the 9 to 12 month point after you have completed all of your treatment. Risk stratification categories are high risk, where we aim for TSH suppression of less than 0.1. Moderate risk, where we aim for TSH suppression of 0.1 to 0.5. Low risk, where we aim for a TSH suppression of 0.3 to 2. If a person remains disease-free for 5 years, their risk will automatically be reduced to low risk stratification, resulting in you requiring less levothyroxine medication, hence reducing the risk associated with taking long-term levothyroxine. You will receive lifelong follow-up appointments where your bloods will be taken to allow for assessment of your TSH level and adjustment of your levothyroxine dose if required. If you have any questions or concerns regarding your levothyroxine, please ask your consultant or your nurse specialist.